As you can see, the key indicators, again, our numbers as far as cases, 1,444 remains high, higher than the 21-day average. Our deaths, tragically, 21 deaths have been reported in the last 24 hours. Hospitalizations are up a little bit from the 21-day average, and we're seeing ICU admissions that are about the same or down one. Again, we don't like to see those numbers that high. We would hope that in some areas of the state, and we'll talk about this in a minute, we hope we're starting to see a plateau, but in other areas we clearly are not. Okay, let's go to the new map. Again, this is a compilation that was done by our data team, and so this is the new map, and let me give you some of the highlights. And let me just start, though, by kind of reminding all of us that the purpose of this map is to inform people in the county of what is going on and what they should be concerned about. These are indicators. It's like a warning. It is like a alarm that's going off that says, hey, this is where your county is. The trend lines are not going in the right direction. There's grave concern. And so we start, of course, with the yellow and then move to the orange and then we move to the red. Let me start with Allen County. Allen County, northwestern part of the state. We are now moving them from just red to red with an alert. If you look at the numbers, and one of the numbers that we keep looking at, and I always have to kind of hesitate to state it correctly, but we look at 2 weeks, how many cases in the last 2 weeks, and then that is figured per 100,000, so that you're comparing apples to apples, a small county versus a large county, but per 100,000 residents. Allen County is at 107. 107 and a half, actually, cases in the last 2 weeks per 100,000 residents. So they moved to the watch list this week. They met 6 indicators. That's the first time they're to 6. The trend is concerning in part because during the past 14 days, 110 coronavirus cases have been identified, which represents 23% of the county's total number of cases since the beginning of the pandemic. So basically almost a quarter within that period of time, within the last 2 weeks. They've seen increases in numbers of people seeking medical care for the coronavirus from their doctors, and also the numbers of people going to emergency rooms for that complaint have gone up. Between July 1 and July 17th, average outpatient visits grew from 5 to 14 visits on an average per day. In Allen County, family and friends taking group trips to hot spots in other states have increased the spread there. One trip resulted in 15 cases that health officials now know about. Friends and family pool parties have also contributed to the county's increasing numbers. County health officials are working very hard to contain the virus, but I would say to my friends in Allen County, they really, really need your help. In every county, we need you to work with your local health officials. Please remember these health department teams are working tirelessly to keep people in their communities safe and healthy. So when they contact you, please cooperate. Give them the information that they need. We now have 8 new counties that are moving to red today. We'll start in a county directly north of where I live, Clark County. Clark County, and I'll give these numbers at the beginning of each county, 84 cases per 100,000 residents in the past 2 weeks. This is the first week that Clark County is being designated as a red or level 3 county. They meet 4 of the indicators. During the past 14 days, 113 coronavirus cases have been identified, which represents 12% of the total number of cases since the beginning of the pandemic. Between July 1st, Clark County's average daily cases increased from 5.5 cases to 12 cases by July 16th. So if you go from July 1, July 16th, their average daily cases increased from 5.5 to 12. Some of the outbreaks in Clark County are linked to youth sports, also long-term care facilities. One faith-based outbreak had 19 cases associated with it. Now, let me turn to the next county. Let's turn to Defiance County. Again, in the northern part of the state, they are at now almost 79 cases per 100,000 residents in the last 2 weeks. Again, that's one of the ways we're looking at this. During the past 2 weeks, Defiance County has seen 30 cases, which is a higher number than any other 2-week period they've had. In fact, over 1/3 of the total cases for the entire pandemic have occurred for that county in the last 2 weeks. In addition to the increase in cases, the county is also seeing a steady increase in the number of people visiting their doctors for coronavirus. Recent outbreaks in the area have included a workplace setting and social gatherings held in a popular recreation area. Erie County. Erie County, 119, almost 120 cases per 100,000 residents in the last 2 weeks. Erie County met 5 indicators this week, and local health officials are concerned with the uptick in cases that they are seeing. In just 2 weeks, 89 new cases, or 23% of the total number of cases during this entire pandemic, have now been reported, making the county a high incidence county as defined by the CDC. Remember, if it's over 100, and they're at 119 per 100,000 residents in the last 2 weeks. If you're over 100, then you're a high incidence county. A recent increase in visits to the emergency department also is very concerning. Many cases have been linked to the Ohio Veterans Home, which has an ongoing outbreak. Erie County has also been impacted, as have other counties in the area, by the recent outbreaks from Put-in Bay. Let's turn to Hardin County. Hardin County is at 51 cases per 100,000 residents in the last 2 weeks. This is the first week that Hardin County is being designated at a risk level 3, red. Hardin County is also seeing an increase in the number of people seeking medical care for coronavirus. From July 10 to July 17th, visits to outpatient settings grew from an average of 3 visits per day to nearly 7. In recent weeks, almost all of the cases were in the community, not in congregate settings. Henry County. Henry County is 159 cases per 100,000 residents in the last 2 weeks. Henry County has met 4 indicators and is being designated risk level 3. During the past 2 weeks, they have seen over half of their cases during the entire pandemic. The county exceeds the high incident category by quite a bit. As defined by the CDC, many of these cases have been traced back to a Name That Tune event at a local winery, which occurred on July 11th. That has resulted so far in 53 cases, 53 related cases to that outbreak that occurred when people gathered together at their winery. It is believed that the number associated with this event may also continue to grow. Let's go down south to Lawrence County. They're at 124 cases per 100,000 residents in the last 2 weeks. Lawrence County is moving into red today. During the past 14 days, 74 cases have been identified in Lawrence County, which represents 46% of the total cases since the beginning of the pandemic. Almost half have occurred in the last 2 weeks. The county exceeds the high incident county rate for coronavirus as defined by the CDC. Between July 1 and July 14th, the average daily cases increased from 1 to nearly 8. Some of the county's cases can be traced back to a bar, some to a bus trip, some as well to a funeral. Let's go back to central Ohio with Marion County. Marion County, they are now at 87.6 cases per 100,000 in the past 2 weeks. Marion has had 57 coronavirus cases identified during the past 2 weeks, which represents about 15% of their total cases since the beginning of the pandemic. Recent outbreaks have included multiple cases associated with children's sleepover parties, as well as a nursing facility outbreak. Let's go up to Medina. They are at 61.8 cases per 100,000 residents. Medina County is now red alert 3 after being at the orange level for the last 3 weeks. According to health officials, Medina County saw 74 cases during the 7-day period of July 6th to the 13th, which is the highest number of cases for a 7-day period since the pandemic began for them. Officials say that the surge in cases did not come from congregate living areas, such as nursing homes or from testing events, but have been traced to graduation parties, weddings, other group gatherings, and out-of-state travel. Additionally, some cases can be linked to Put-in-Bay as well as the Athens County outbreaks, where people went to socialize and then returned home and spread the virus. We have 2 counties this week that, despite meeting fewer indicators, remain red counties due to the fact that they exceed the CDC guidelines for high incidence of COVID. And they exceed it by, as you'll see, with quite a bit. Franklin County has had more than 225 cases per 100,000 residents over the past 2 weeks. Licking County has had more than 110 cases per 100,000 residents over the same period of time. Additionally, we have 4 counties where the spread of the virus is not increasing as fast as it once was, leading these previously red counties to be orange this week. And again, as you'll continue to see throughout this, it is the rate of increase that we look at, how fast it is moving. These counties that change now to orange: Butler, Lorain, Summit, and Wood counties. Butler, Lorain, Summit, and Wood counties. However, all 4 of these, and I would just say all 4 of these, are pretty close. They remain close to the CDC definition of where you have a significant problem. For example, all of them are at the moderately high incidence, according to the CDC. But 2 almost hit the definition of high, and if they would have, then they would have stayed red. Wood County had 99.4, so they are literally right on the line between the red and the orange. Butler County is right on the line too. They're at 97.88 cases per 100,000 residents over the same period of time. So they move forward. They slip down, which is a good thing, from the red to the orange, but they're still hovering very, very close to this. I think what this tells us is that overall the measures that we've been focusing on to mitigate COVID-19 spread in the red counties, increased diligence in social distancing, wearing masks, washing hands frequently, reducing interactions with others outside your household, may be helping to slow the increase in these counties. Again, we've got to wait, but we think that that is certainly the mask wearing is helping in those counties, because we've seen that go up. We are cautious about this, though. These are still high levels of spread. Still high levels of spread. Citizens across Ohio and these counties really need to continue to be vigilant in following the layers of protection that we continue to talk about. We've talked a lot about long-term care facility outbreaks during this pandemic, because this is where many of our most vulnerable people live. I want to tell you about a case that we learned about that is particularly troubling. And we talk about these cases because I think, for me at least, it's instructive about what's going on out there and where our problems are. 2 young women traveled out of state to Texas. They became sick after driving back together. They did not isolate when they came back because there were no orders requiring them to do so, and they did not voluntarily do that. One of the women had a headache but went to work in a nursing home after she got back. She tested positive later for coronavirus, but it was then too late. There are 30 cases in that nursing home. So this is, again, it's instructive, and we're not trying to put blame on people, but we're trying to illustrate how these occur and why it is important when people have symptoms, when they think there may be a problem, for them to be very, very, very careful. And again, you know, we know what works. If they had returned from a high-risk location, started feeling sick after they got back, and if they had isolated themselves as soon as they got back, they could have stopped the spread of the virus. Let me also mention a few other things that we have learned in the last several days. One county told us this week that they have 7 outbreaks, but they all have small numbers that are tied to them. So again, showing a lot of community spread. In a county, in this case a county with hundreds of cases, these outbreaks each had 3 to 12 cases associated with them. Another county said that what they're seeing is a lot of family spread. One member of the family gets the virus, then passes it on and infects the rest of the family. If the first person to bring it into the family doesn't have symptoms, they probably are going to go on with their daily lives, going to work or playing with friends. It's not till someone in the family gets sick that they are tested, and then they start the isolation or the quarantine.